like, I'm not dressing up today.
Oh, that's how I am. I'm in sweatpants, so all I have to do is I'm just so ready for Thanksgiving at this point.
That's fair.
Yeah. So I'm gonna introduce us. I'm Charlie. I will be interviewing you today, and how do you say your last name?
Perutka.
Okay, so um, you're Christina Peruta? Okay. Sorry.
Perfect.
Uh, and you are a pediatric geneticist, is that correct?
Yes.
Okay. So usually we would do this in person around January, but for COVID reasons, we are doing this on Zoom for just so nobody gets infected and there's a whole outbreak at school. So it's better than doing it like doing exams. So seniors get to do the project for their first semester exams. So, and I'm pretty new to this because I just switched to Bishop my senior year. Uh, so I'm gonna go ahead and list my goals. This is like what I want to get out of our Zoom meeting. Um,
Okay.
so actually, I'm gonna go through the questions first. So
Okay.
I have 14 questions. Um,
Okay.
and I'm just going to go in order. So, where did you attend college? What was your major? What made you interested in your field of work? What graduate school did you attend? What was your major or focus in graduate school? How long did you attend graduate school? Can you explain what kind of clinical training you were involved in? Can you describe what HPP is? What made you interested in HPP? Um, have you ever worked on a PANDAS patient? Can you tell me what PANDAS stands for and what are the patient's initial symptoms are? What was your most memorable case? How did you communicate with other doctors about the patient's diagnoses and treatment plan? And what piece of advice would you give someone considering a career as a pediatric geneticist? And then my goals are to know what kind of major is beneficial to your career, to see how long graduate school is for your career, what made you interested in this field of work, to apply what your major was to excel my chances of getting into graduate school, to identify and understand what HPP is, to understand what kind of clinical training is required, to identify what made you interested in treating patients with metabolic genetic diseases, to understand how you communicate with other healthcare providers to treat the patient, to understand what PANDAS is and how it is treated, and to use your advice and apply it to my decision of going into the medical field. So, I'm going to go ahead and redo my questions. So, where did you attend college?
Sure. So I'm originally from North Carolina. I live in Virginia now, but I attended college at East Carolina University in Greenville, North Carolina.
That's great. And what was your major?
So I majored in biology, and then I also actually did a minor in Hispanic studies. And that was interesting. I had the opportunity to do a double major or minor and study
Yeah.
abroad. And I minored and studied abroad, which I actually feel was a very good decision, life decision in the end, because that's really where I developed fluency in Spanish. And that's a skill that I've continued to use throughout my career.
That's great. So where did you go for your study abroad?
Sure. So I went to a private university in Cordoba, Argentina. So that's kind of the university center in that country. And I went for 6 months, and I took classes in Spanish history or Argentinian history, and then some language arts classes, so reading literature and poetry and things like that. So
That's
it was really fun.
Yeah, that sounds super fun. What made you interested in your field of work?
Yeah, so that's a really great question. I when I was in high school, I was debating between doing a career in music. I was a flute player and I was really involved with music. But I also really loved my chemistry courses. And so when it came time to decide what to do for a living, I decided that I was a little too picky and choosy when it came to what types of music I liked. And I figured, well, I really liked classical music and orchestral music. And I was thinking, there's only 2 flute seats in an orchestra. And so I probably should do something with better job security. So I have continued to play flute and I still enjoy music to this day. But I decided I was probably going to go into the science route. And when I was in high school, my mom encouraged me. My mom's a pharmacist, and she encouraged me to do some shadowing in the hospital. And surprisingly, one of my most enjoyable volunteer activities was volunteering with Child Life. And that's when I kind of, I guess, put 2 and 2 together, that I really like science and I really like working with kids. And I learned, oh, I can work with sick children. And so I applied for something called the Early Assurance Program, which is where you apply for medical school and high school. So
Wow.
getting accepted for medical school to the Brody School of Medicine at East Carolina as a senior. And so I went to college and then started medical school with the thought that I was going to be a pediatrician, which I am. And I'm happy, I still ended up as a pediatrician. But during college, then I felt like, well, I will just take classes that I enjoy because I'm already accepted to graduate school and medical school. So this is my time to learn and grow and take things that I enjoy. So a lot of my seniors in my field, I was a biology major, as I mentioned, recommended the genetics course with this professor named Dr. Lamb. And so I had no idea that you could be a clinical geneticist. So I actually took genetics just because it was a recommended class and people really liked the professor. And then I went on to do research with Dr. Lamb, and it wasn't until medical school that I discovered you could do clinical genetics. So when I was in medical school, which is the equivalent of graduate school, I guess, for physicians, which answers, I think, one of your questions.
Yeah.
When I was in medical school, you go through rotations in all different core specialties, one of which is pediatrics. And while I had really enjoyed working with the child life specialists and had volunteered on the pediatric ward in a hospital, one thing I noticed about general practice and primary care was that the appointment times are generally about 15 minutes. And I'm someone who, likes medical mysteries and complex patients. And I realized quickly that I wasn't very happy with the 15-minute appointments. And so our genetics course in medical school was actually partially taught by a clinical geneticist. And when I worked with the clinical geneticist, I realized that the appointments are an hour long and you still very much do a lot of primary care. I did pediatrics ultimately in genetics, but in genetics, we see families and we follow those families throughout their lifetime. So it's a lot of primary care, but it's also highly specialized care. And you get to have continuity of care. So that's kind of how I arrived at genetics.
That's great. Wow, that was kind of like my mind is blown right now. That's great. So how long did you attend graduate school?
Sure. So that's a great question too. So medical school is 4 years, and that's true throughout the country. So my graduate school is 4 years, and then after medical school, as you know, medical students, when they graduate, they're considered physicians, but in order to practice in this country, you go on to residency training, and some people go on to fellowship training. And the length of residency training is really dependent on the field that you choose. Most residencies are at least 3 years.
Yeah.
I knew that at that point that I wanted to do pediatrics and medical genetics. And there are a variety of ways that you can do that. So I had applied after medical school to a variety of programs, both to do general pediatrics, thinking, okay, once I finish 3 years of peds, I can go on to do 2 to 3 years of genetics. But then I also applied to programs and ultimately chose a program that combined my pediatric and medical genetics training. So I did a combined residency at Johns Hopkins, and that was an additional 5 years after my 4 years of medical school. And then after residency, I did a 1-year fellowship in medical biochemical genetics, which I can explain in a second, and that I did at the National Institutes of Health. So what is medical biochemical genetics? Everybody knows that in the United States, we do something called a newborn screen where we look for treatable conditions. Most conditions on the newborn screen are looking for disorders of metabolism. So patients who have trouble digesting the sugar, fat, or protein that we take in through nutrition. And so medical biochemical geneticists treat those patients and follow them for their lifetime, so into adulthood. And then we also treat things that are just being added to the newborn screen, things like storage conditions and other more complicated medical biochemical conditions that aren't able to be screened yet as newborns. So I do pediatrics, genetics, and then medical biochemical genetics now.
Wow. So my next question is, can you explain what kind of clinical training you were involved in? And I think we touched on that. So
yeah, so to summarize, and that I sort of bridged into the next question with the lab.
I don't mind.
The clinical training then would have been 5 years combined of pediatrics and medical genetics, followed by a year specializing in medical biochemical genetics.
And I was looking over your CV and I saw that you did articles on HPP. So can you tell me what that is?
Sure. So hypophosphatasia is an example of a medical biochemical condition, not one that we screen for in newborn screen, but is a condition where you aren't able to form your bones correctly. And that's because you don't have a working copy, or you have 2 not working copies of the gene for something called tissue nonspecific alkaline phosphatase. So those patients, interestingly, in addition to their metabolic bone disease and not being able to build bone because they don't have enough enzyme to do so, they can also have signs and symptoms throughout their body because that enzyme works, for example, in the brain to metabolize vitamin B6. So people who can't metabolize B6 in the brain have seizures. It can affect eye health. So instead of putting calcium on your bones where it's supposed to go, people can get calcium deposited abnormally in their eyes or in their kidneys, causing kidney stones. They can have really bad muscle pain and chronic pain, fractures that don't heal because in addition to not building bone, it's difficult to repair bone. So that in a nutshell is hypophosphatasia.
And what made you interested in HPP?
Great question. So I am all about taking advantage of opportunities that are available. So I think it's really difficult to plan your life from age 15 to the time you're 65. And probably my biggest lesson for people who are young and thinking about a career is take advantage of working with great people and take advantage of opportunities, because I think throughout your life there are all kinds of opportunities to learn, but really joining on teams with great people is going to give you the best opportunities. So as a trainee, you go to school and obviously you don't know everything, you're there to learn. And I was sort of interested in learning a little bit more about the process of clinical research. And one of my attendings in particular at my residency program was very good at clinical research. And so when I talked with that attending about opportunities, the attending mentioned that she was starting some projects on hypophosphatasia. So for me, it was about picking a good mentor who would help me with a project that I could finish in training. And then because I went on to do additional metabolic training, now I see and treat patients with that condition. And, I have expertise, whereas other physicians don't. And it's because of taking advantage of that opportunity when I was still a resident.
Yeah. And I'm pretty sure my mom has mentioned to you that I was interested in learning about pandas, and she told me that you have worked on a patient with pandas. So can you explain like what that is and the symptoms and what you saw in these patients?
Sure. So pandas is definitely, I would say, more of probably a general pediatric versus infectious disease condition. And I also think it's a little bit of a condition that's what I call a bucket diagnosis. So one that I think the etiology is poorly understood. It's been ascribed to multiple patients, but it's unclear, A, exactly what the etiology is, and then B, what the best treatment is. My general understanding of PANDAS, which, as you know, PANDAS stands for a pediatric autoimmune neuropsychiatric disorder associated with strep infections. And sort of a nuts and bolts explanation for people who aren't familiar with that condition is that patients, primarily children, will get, after the age of 3 is typically when children get strep infections. They get a strep infection, and then it's sort of thought that there's a cross reaction with the patient's own immune system that results in neuropsychiatric symptoms. So things like increased anxiety, obsessive compulsive disorder, tics, things like that. It is very interesting that strep also has cross-reactivity with the immune system and causes other post-strep phenomena like post-strep glomerulonephritis, for example. And also patients can get, as you know, rheumatic fever, which has heart manifestations, immune manifestations, and also has some neurologic manifestations when you think about things like symptoms, chorea, and things like that. So I think, strep, the reason why it's a little bit debated is often, even there's a correlate, for example, with people worried about vaccines causing autism, things like that. And I think the concern for a lot of people in the general pediatric community is that, just like vaccines, most all children get vaccines, but only a small percentage of them go to develop autism. Many children likewise get strep infections, but only a very small percentage of children go on to develop severe neuropsychiatric disease, like severe anxiety or obsessive compulsive disorder. And it's interesting because we had a big conference at UVA through Grand Rounds earlier this year on PANDAS. And one point, I think, just as a geneticist that I want to make sure to discuss is I think any child with severe psychiatric illness, it's important not to just assume, oh, that's because they had a strep infection, because like I said, right, many children have strep infections. And those children really should have a comprehensive, independent evaluation for why they also have severe psychiatric disease.
Yeah.
And then one patient that I had with PANDAS or presumed PANDAS was actually when I was a medical student. I did an external rotation at the National Institutes of Health. So this was before I was a fellow there. And it was a patient admitted to the psychiatric ward for severe psychiatric illness in the setting of previous strep infections. And, you know, as recommended, I think what's important to know about her history is just that they did proceed with an extensive evaluation, because you wouldn't want to assume that it's just from strep.
Yeah.
Definitely sort of a mystery condition that deserves more research.
Mm-hmm.
But remember, be comprehensive when you're thinking about your patients.
Yeah. And what was your most memorable case of any genetic disorder?
Oh. Oh, that's a hard question. I mean, I think by the time you are in medicine, as long as I've been in medicine, I've easily seen thousands of patients. Yeah, I think that's a hard question. Maybe my most memorable patient, I love what I do because I have an opportunity often to think outside the box.
Yeah.
And I have the luxury of time in order to do that. And I also, being in genetics, we really have cutting edge technology in terms of the ability to test patients and diagnose patients. There's another condition that's relatively common in the general population, something called Ehlers-Danlos syndrome. And it's one of the more frequent indications for referral to genetics clinic. Individuals with hypermobile type Ehlers-Danlos, there are several types of Ehlers-Danlos, but individuals with hypermobile type Ehlers-Danlos have increased mobility of their joints, and as a result, they tend to suffer from early joint disease and then chronic pain. And they can also have things like irritable bowel syndrome, bad reflux, constipation or diarrhea, so GI side effects, and then can also have laxity in their other connective tissues, so suffer from, for example, varicose veins, etc. So probably one of my most memorable patients was referred for an evaluation for hypermobile Ehlers-Danlos syndrome. And what I'll mention is that Ehlers-Danlos syndrome is a condition for which we don't at this time know the genetic cause. So it's a diagnosis of exclusion. And this patient had been struggling for decades with symptoms of hypermobility. But when she saw me, she had a very abnormal neurologic exam as well. So she was a young woman, and when she opened her mouth, the back of her mouth was asymmetric, which is, for people interested in medicine, that's a very, very abnormal sign. Yeah. She had difficulty swallowing, also something you don't expect for a young woman. Mm-hmm. And then she had these other neurologic signs like weakness, that would come and go. And I was thinking, this isn't hypermobile type Ehlers-Danlos. And she also had this very interesting history where she had more than 20 infections requiring antibiotics in the first year. Oh my gosh. They're only 12 months in 1 year. So she basically was on antibiotics for the first year of life and then went on to have fevers throughout childhood, and then often had very dark urine and pain with urination after fever. So in summary, I thought, this is not just hypermobile joints. This is not hypermobile Ehlers-Danlos. Mm-hmm. And me being primarily a pediatric physician, I sent her for a variety of consultations. And it took us about a year to get her exact signs and symptoms worked out. And then we sent an extensive test called whole exome sequencing on her. and we found a diagnosis of familial Mediterranean fever. So
Wow.
talk about something that's not just hypermobility. And I think that was probably a very memorable case for me because it's an example of a patient. You know, a lot of times people who come to genetics have been searching for a diagnosis for decades. Your mom will tell you that this is also true for patients with HPP, but I just thought her case was really rewarding because we ended up finding a diagnosis that's actually easily treatable with colchicine. And she just messaged me a few weeks ago that she feels so much better since she
That's
started
great.
therapy. So it was a very rewarding case for me.
That's great. Um, how do you communicate with other doctors about patients' diagnoses and treatment plan?
Sure. So there's a variety of ways to do that. If you have a patient, for example, in the hospital, normally doctors participate on what we call multidisciplinary rounds. And so often, you know, in the morning, you're going around and seeing patients, and then you discuss with the other doctors on the medical team what the plans are, what the thought processes are, and then ultimately what the diagnosis and management will be. In the outpatient setting, things move a little bit more slowly.
Mm-hmm.
So often you have to wait, you know, as was the case with the patient I just described. You have to refer a patient for an opinion by another consultant and then wait for that appointment to happen and those recommendations to be made. But then, you know, often I just pick up the phone and call people because I think more and more, you know, when you see complex patients, you realize that, you know, sometimes you just have to call someone with different expertise and put your heads together to figure out what's going on with the patient. And that actually is what I did for the last patient. I ended up calling who I was referring her to and said, hey, this is the background. This is my thought process. Would you consider starting therapy, colchicine, for this patient? And she did. But I think having that conversation to co-manage the patient was really ultimately helpful.
Yeah. And what piece of advice would you give someone considering a field as a pediatric geneticist?
Well, I sort of touched on this before. I think probably the most important thing is to take advantage of great opportunities that come your way. You never know where life is going to lead you, and I think you can't plan every step of the way, but working with great people, going to great places, taking advantage of great opportunities. You know, for me, that's always been a way that I found my career and my path really rewarding and enjoyable. And I think it's because I'm someone who just takes advantage of those opportunities that come my way.
That's great. And do you have any questions for me?
So your mom was telling me that you have a little bit of interest in medicine, and I was curious. One thing I like to ask people who are interested in medicine, I feel like nowadays medicine is so broad. You know, you
Yeah.
can so many different types of medical professionals. So I was curious what different types of medical professions you've considered and sort of how you've explored those options.
Yeah. So I first, it was in middle school, I was very interested in neurology. I started getting migraines in middle school, and we have like no family history of migraines. And so it was very out of the ordinary for me. And so I was like, well, I want to explore the brain because it was just so interesting in having two parents who've been in the medical field and who, I mean, I've just seen so many different sides that, you know, I've never thought I would understand or consider. And then going into high school, I still loved learning about neurology, but going into my sophomore year, that summer I did a medical camp at Carolina, and it was called the National Youth Leadership Forum in Medicine. So I was there for about 14 days, and I got to really explore like my horizons on medicine. I got to talk to Dr. Kippy, who is the head of, I think, liver surgery in Carolina, which I was beyond, like, I was astonished. I was like, oh my gosh, like there's so many advancements going on. And then I got to learn about like, you know, performing pretty much like EMT, like if you were in the woods or hiking and somebody like fell down a mountain, like what would you do? So I got very interested in that. And then I came across pandas one day, actually on YouTube. And I was like, it was the story about, I think, this 6-year-old girl who developed strep, and her mom was describing it like overnight she became this different person, very aggressive and had these outbursts. And I was like, I grew up having strep throat a lot, and I got my tonsils out at a young age. And so I was like, wow. And that really sparked my interest into infectious disease. Pretty much, I wanted to be a pediatric neurologist who focused on infectious disease. And then my junior year, I took a class. It was health science, and it's like a pre-class into nursing. So if I stayed at public school, I would graduate my senior year with a CNA. Unfortunately, I didn't get to do that. Yeah. Fortunately, I didn't get to do that because of the pandemic and switching schools. But that, and then with COVID coming along, I got very interested in infectious disease, and I was like, wow, like it was just like a matter of months where COVID, there's more and more articles coming out on it. And I was one of the people who were like, oh, the flu's so much worse, like this is nothing. And now I'm like, I didn't know anything about COVID, and I didn't know its genetic sequences, and that it's a RNA virus and how easily it can affect other body systems. So that sparked my interest into virology. So I'm hoping right now, I've applied to most programs. I'm hoping to do a double major in microbiology and in public health to understand how, infectious disease that can affect a population and how severe it can get. So yeah, virology is my biggest interest right now.
That's really cool. I think listening to you talk, it might be helpful to shadow a pediatric infectious disease specialist.
Yeah.
And I have to say, if I didn't become a geneticist, I think I would have done infectious disease.
Yeah.
I also find infectious disease fascinating, and microbiology in medical school was by far one of my favorite courses. And I always think, I mean, hopefully one day I'll get to do, because I did a lot of medical missions, so outreach for, medical purposes.
Yeah.
I went to South America a number of times, and I always loved those trips. I went as part of a pediatric and obstetrics team. But I always think, oh my gosh, you can easily do public health and international travel if you're a surgeon, because they need things like you can join the Smile Train or whatever and fix cleft lips and palates. Other field where you get to travel and do really cool stuff is infectious disease. And so I don't know, just hearing you talk, because infectious disease, you also think about central nervous system infections. And so there is, to a degree, some neurology in there, but there's a lot of virology and antibiotics and new therapies. And so it's definitely a really cool field.
Yeah, I just love it. I do a lot of reading on infectious disease, and I read a book earlier this year about this doctor who did research on antibiotic resistance in, I think, MRSA. And I was just like, I was just so blown away. I would like go downstairs to my mom. I was like, "Do you know like this and this?" And she was like, "You're 17. Like, this is too much for me." And now I'm just like having these conversations, and she's just like, I'm like going over her head in some subjects, and it's very interesting. Especially, I love hearing about Dr. Fauci, and I'm like, it's just so interesting. So.
Well, good luck. I'm excited for you.
Yeah. Thank you. And thank you so much for meeting with me.
Oh, you're so welcome. And if you're ever in Charlottesville, let me know. I always like having learners. I think I have 4 or 5 at a time in clinic. So
That's great. Yeah,
it's very standard.
I'm looking at Virginia Tech right now.
Oh, there you go.
I loved we went out there one weekend and we just walked the campus since they're not doing on-campus tours, and I was just like, I felt very connected. Like, I love it up in Virginia. It's very beautiful up there.
Perfect. Wasn't your mom a UVA graduate?
Yes, I think so. Yes. And
I
she's
thought
like,
so. So there will be some rivalry in your house.
yeah, there definitely will be.
That's fair. My sisters went to Chapel Hill and I went to ECU. So I'm like, oh, Pirates versus Tar Heels. So
Yeah, that's where my sister's thinking. She's like dead set on Carolina, and she has her backup schools, but she's just since like 8th grade, she's like, I'm going to Carolina. That's my top school. I
that's
was just
very
like,
fair.
go for it. Yeah.
Very good. Well, Charlie, thanks too for asking me to interview with you. I've enjoyed talking with you. And if you do have questions that come up in the future about medicine, I'm always happy to talk with you a little bit more.
Okay, thank you very much.
All right. Take care.
You too. Have a good Thanksgiving.
You too. Bye.
Bye.